Hello, it's Dr. Chris Lauria from Disc Centers of America, and welcome to our first live stream here on Facebook Live, LinkedIn, and YouTube. Uh, we'll be doing this weekly, bi-weekly, to educate people on chronic pain due to degenerative, bulging, ruptured, herniated discs. So I'm just going to give people a couple of minutes here, or about a minute to sign on and get the information that we want to give this evening. Again, we'll be doing this weekly, bi-weekly. At the end, you'll see an email address, and if you have a specific topic that you're interested in me talking about or discussing when it comes to chronic pain in your back or neck due to degenerative bulging, ruptured discs, things like that, I can definitely answer those questions. If you have any questions tonight, you can just message me, and we'll be able to answer those questions this evening. So I think we're good. Let's get started here. So um, again, I'm the head doctor, physician, chiropractor at Disc Centers of America, and the focus of our office is to work with people. We don't do chiropractic care. We do spinal decompression therapy and laser therapy to help people with degenerative bulging, ruptured, herniated discs in their spine. And one of the questions I get continually, and I get patients that come in that say on their first visit or their consultation that, I have a slip disc. I said, "Oh, well, that, yes, you do. Did they explain what that is?" And they say, "No, I have no idea what a slip disc is." And it's a term that's commonly used, but most people don't have an explanation. I see that across the board too, that most people don't understand what's on their MRI, what is the diagnosis of why they're dealing with back pain, neck pain, sciatica, numbness, tingling, and those type of things. So what I wanted to do tonight was answer that question for people because it's a term that's used all around, and I want people to be able to understand what they have and what can be done to help it. So basically, you have your spine, you have your vertebrae, and in between each vertebrae is something called a disc. And I have just to make it easier, I have a bagel with some cream cheese in the middle. And that's basically what you want to think of the disc as. And the discs are definitely shock absorbers for the vertebrae. They also help to create spacing and holes in between your vertebrae that your spinal nerves pass through. And they'll stay healthy, they'll stay moist, they'll stay vibrant as long as normal pressure is put on them. Now, abnormal pressure will cause problems with the disc. It'll cause them to break down, to wear out, and degenerate. And that's where slip disc comes in. I want you to think of the disc or the what we have here in the middle of it, this whipped cream, as a jelly filled donut. There's a thick outer surface. I'm sorry, there's a gooey inner surface like the jelly, and then there's a bunch of outer bands, and that jelly is designed to send nutrients to the disc. Well, if normal pressure is put on that disc, everything's fine. But if you put abnormal pressure on the disc, that disc begins to wear out, and that fluid or jelly inside starts to harden. And when that jelly hardens, it can't send the nutrients to the outer part of the disc, and the disc will begin to thin. And that's what degenerative disc disease is. It's a loss of fluid thing in the disc. It can lead to pain and numbness and tingling, muscle spasm, muscle weakness, and those type of things. If that's left long enough, okay, the disc will wear out even more, and the outer bands will begin to wear out, and that jelly will push its way out to the surface like this is here, and the whipped cream will start to push out. And that's what a bulging disc is. Okay. And that's one thing. When they tell you have a slip disc, it could be a disc bulge. Again, the lexicon, the way they describe these things is a little bit confusing. Once that disc is bulging, it's not functioning right, you're still putting abnormal pressure on the disc. Eventually, that bulge can pop open, the fluid can begin to leak out, like we have here in our sample. Uh, and that is what's called a ruptured or herniated disc. And that's where the balloons popped open, the jelly's leaking out, and the whole compensation of the disc is completely broken open. That's what a ruptured disc is, or a herniated disc. Now, typically, when they tell you got a slip disc, it's usually a bulging disc or a herniated disc. that it's broken open and the fluid's leaking out. So those are the different levels of the breakdown of the disc. And really, the last two are what can be called a slip disc. Now, I have had patients come in and talk to me that they had an x-ray and a doctor told them they had a slip disc. Well, there's ways to kind of guess at that, to determine it, but the only true way to determine if you've got a slip, bulging, ruptured, or herniated disc, and even the advancement of degenerative disc disease, is to get an MRI done. So MRI, CT scans are key. That's a key part of our office in determining if you are a candidate for the programs that we offer to treat these type of conditions. So if someone tells you you got a slip disc, I would tell you, ask them, well, exactly what does that mean? And have them describe whether it's a bulging disc, whether it's a herniated disc, which part of the disc is ruptured. It can affect nerve roots on one side or another. It can affect both nerve roots, and the severity of it can cause different symptoms. There are diagnostic tests will help us determine and help us determine exactly what the MRI's results are and whether or not we can help someone in that type of case. If someone comes into our office and they are suffering with severe back pain, sciatica, neck pain, pain, numbness, tingling running down their arms, and they've tried shots, they've tried physical therapy, they've tried chiropractic care and those type of things, and they're still suffering, and they have a ruptured, herniated, or slipped disc in their spine, we can properly diagnose that and treat them with a non-surgical treatment protocol, which is called spinal decompression therapy. It's not traction. I'll explain that on another live event that we have. But decompression therapy is a treatment protocol that would per se pump the disc, pull and relax, pull and relax, pull and relax. And what that does is sets up a pressure gradient and sucks the disc bulges, herniations back into the normal space again. So it's a non-surgical treatment. There's plenty of studies, the McClure study, the Abbott study. There's been studies at Harvard School of Medicine, different places on the efficacy of this and the treatment protocols and results to help these type of situations. And then we also use laser therapy in our office to help the body create a reaction that will help the disc heal, that helps with inflammation, irritation, and those type of things too. The key to this though is you got to be a candidate, okay? And we got to have a correct diagnosis. So just saying you have a slip disc doesn't immediately make you a candidate for this type of treatment protocol. Um, the way we do that at our office is our initial evaluation. So, if you're interested in that, you can set up a time to come in our office, and we would set up a time to go over your case. It's complimentary to come in. You'll come in and we'll discuss your case in detail. There's some pre-qualifying questions. If you are someone that has metal in your spine, you're immediately not a candidate for spinal decompression therapy. If you have fractures, compression fractures due to osteoporosis or trauma, you're not a candidate for spinal decompression therapy. Obviously, if you're pregnant, if you have a cancer of the spine, all these things are immediately disqualifiers. But the next step is to determine you're a candidate. And then you'll come into our office. I'll discuss in detail your case, the symptoms you're having, what you've tried that hasn't worked. Typically, we hear that they've tried shots and physical therapy and those type of things. Then we'll do a 4-point exam where I'll do a EMG test, which measures nerve and muscle function. We will do neurological, orthopedic testing, range of motion, and those type of things. All these things are going to help me determine if we can help you. The key part of this is to review your MRI. Okay. And if you have an MRI that's current, we can use that. A lot of candidates where we have to send them to get an MRI to properly determine if you have a slipped disc. Okay. Once we do that, determine you're a candidate, we develop a care plan. We talk about your reported findings, which is a key part about exactly what's going on. And for a lot of people, this is the first time someone goes over their MRI in detail and explains to them what's going on. So I will do that. And then we'll talk about our disc pain relief treatment protocol. And it's different for everybody, depending on how many disc problems you have, the severity of them. Do you have bulges, herniations, those type of things? We'll set up a specific program for you that's designed to help treat the disc problem that you have to help you get your quality of life back. So that's what happens in our office. We do not do a free visit or test. Spinal decompression is not designed to do that. There are specific protocols and all the studies that need to be followed in order to ensure the best success in your case. So one 10-minute test does not work. You know, typically when that's done, it's done at a very low weight that's not doing a lot at all, because if you don't know exactly what's going on and the exact angles and weights, you can make the problem worse. So we don't do that in our office. Um, we want you to learn exactly what's going on and determine if decompression is a choice that you want to make to help your case. So that's what we do in our office, and that's what a slip disc is. Hopefully, this helped you. Again, if you're interested in setting up a complimentary consultation, you can call our office at 540-600-4630. It's not on the scroll, but I'll add that next time. You can also very easily ask questions without calling by emailing info at Roanoke disc DISC center.com. That's the email into the office. If you have a question about tonight's Facebook Live or any questions about your case, feel free to email us. And then you can also follow the Disc Centers of America uh, Facebook page, which also contains some valuable information. Our website is www.roanokedisccenter.com. There is tons of research on there, tons of information in order for you to educate yourself on disc problems and excuse me, what can be done to help them. So I appreciate you signing in tonight. Hopefully you got something, some good information like that, and looking forward maybe someday to seeing you in the office. Thank you.